You guys all set? We all good? You guys good? Well, good afternoon, everyone. We are here today in Scioto County because of the concern about what is going on with number of cases and frankly, our hospitals really filling up. Earlier this week, we heard from our children's hospitals. They did a conference call with all the school superintendents around the state of Ohio, and then they were part of a press conference that we held. They talked about the problem they were seeing and really described it as a critical situation. Not only are the children's hospitals filling up with young people who have COVID, but they're also seeing a number of other respiratory problems that normally are seen in the winter. And this is causing some real concern in the children's hospitals about their ability to be able to handle other patients, young people who might need part of an accident or need some other kind of help. So that's of big concern. Their message was very clear, and they called on every single school in the state of Ohio to have a mask mandate. And we have seen actually a good increase in those numbers. As of today, 58% of the school children in public schools in the state of Ohio are in fact masked. But we have a way to go, and we need to really improve that. So I want to again urge all the school superintendents, all the school boards to look at this and at least on a temporary basis to require everyone in their building to be wearing a mask. Last year, with everyone wearing a mask in school, we did not have much spread in school. And the schools that wanted to stay open basically stayed open. And it kept kids in school. Our goal has to be to keep kids in school. And I think everybody agrees that that's important this year. And the only way we're going to do that is to have more children vaccinated, those 12 years of age and older, who now can be vaccinated. And in addition to that, for those not vaccinated, wearing masks in the classroom. Very different from last year. Last year, and people are wondering, why are we seeing cases spread in school now? Why are we seeing so many children quarantined? And the answer is really twofold. One is the Delta variant. The Delta variant is much more dangerous. It's much more contagious. It spreads much faster. And that's what we're dealing with today. Second is last year, of course, everyone was wearing a mask. And now we have a number of schools where children are not wearing masks. So we are asking the schools to take a look at that and help out, slow the spread, keep your kids in school. That's really the way to do that. I want to talk now about our adult hospitals, but before I do, I'm going to turn it next over to Dr. Vanderhoff, who is the Ohio Director of Health. He's going to talk about what's going on in some of our hospitals. Amy Freyline, Director of Critical Care at Southern Ohio Medical Center, will then speak, and then we'll hear from our health departments in Lawrence County and Scioto County. Before I do that, though, I want to share some data. No matter where you live in the state of Ohio, you live in a county that has a very high incidence of COVID today. Early on in the pandemic, if you lived in a rural county in southern Ohio, you were not seeing a lot of COVID. That is simply not true today. Every day we look back for 14 days and see the number of cases that have been diagnosed in each county. Sadly, the number one county is Pike County. Pike County is number one. In the last 2 weeks, they have had 538 confirmed cases. So it's a phenomenal number for a small county like Pike County. The number 3 county is Lawrence County. Lawrence County, in the last 2 weeks, has had 965 cases. And that is at a very, very high rate. As I said, it's the third highest rate out of 88 counties in the state. Scioto County is number 5. Scioto County has had 1,204 cases in the last 2 weeks. So these are very, very high. Just to tell you how high they are, If you look at number of cases per 100,000 over a 2-week period of time, which is how the CDC and others rate things. If you're at 100, if your county's at 100, that's considered a high incidence level. Pike County is 19 times that. Lawrence County is 16 times that. And Scioto County is 16 times that. So we're at a very, very, very high rate here in southern Ohio. So I'm going to turn it now to Dr. Vanderhoff, and he's going to talk about what we're seeing in regard to our hospitals. Doctor.
Thank you, Governor. Well, as the governor has indicated, we are seeing dramatic increases in the number of people who are ending up in our hospitals, and that dramatic rise has been going on since really the beginning of July. Our hospitals are and have now been sounding a real alarm. This is a surge in cases which is clearly being driven by the unvaccinated here in Ohio, and now those volumes of unvaccinated sick people are really putting tremendous pressure on the capabilities of our hospitals, even as our healthcare workforce is becoming worn out. Our healthcare heroes have now for 18 months been working tirelessly to care for those who are sick and suffering from COVID-19, and we're beginning to see them reach a point of fatigue. Hospitals are having to respond in a variety of ways to assure that people who have the most serious need for care continue to get it. You'll see hospitals that are rescheduling elective procedures. You'll see some diversion of patients from a hospital that may be extremely busy at one time to another hospital that steps in to take some of the load. You'll see innovations going on, such as the ability to care for patients with COVID-19 at home through COVID at home programs that are eliminating the need for hospital-based care. You'll see triage occurring in some of our emergency rooms where physicians are stepping forward to provide triage at the front door of the emergency room. But make no mistake, the Delta variant of COVID-19 is relentlessly seeking out anyone who does not have immunity. And that means the unvaccinated are really looking at a picture of when, not if, they become ill with COVID-19. Now, it also means that we, as members of communities, need to be very thoughtful about how and where we're seeking care at this time. If you have a less serious concern, we'd ask that you not go to the emergency room before calling your primary care doctor or considering a telehealth visit, or perhaps going to one of the clinics that might be in a pharmacy or a grocery store. We also would like you to think very carefully about where you're going to receive a routine test for COVID-19. Too often, we're hearing that people are showing up in the emergency room for a COVID-19 test so that they can attend an event or travel. We want to remind people that COVID-19 testing is available in a wide variety of locations outside the hospital, including commercially available tests, and of course, tests that the state is making available through libraries, through public health departments, and through various clinics. If you are looking for where to go for a COVID test, look at our website, coronavirus.ohio.gov. So our message is clear. In the era of the Delta variant of COVID-19, if you are not vaccinated, you will ultimately become ill with COVID-19. You will be infected with COVID-19. And COVID-19 is not a benign virus. You'll hear from some of the physicians today that there are otherwise pretty healthy people, young people, who are getting very sick with this in the hospitals, and sadly, some who are dying. Your best protection, hands down, is to get vaccinated. So if you are not vaccinated, please do your hospitals, your families, yourself a favor and get vaccinated as soon as possible. Thank you, Governor.
Good afternoon. My name's Amy Fraulini. I'm the Director of Critical Care and Heart and Vascular Services at Southern Ohio Medical Center, our regional hospital here in Southern Ohio. We've been living with COVID-19 for the last year and a half, but like was already talked about, we've been really seeing a second surge here this summer. The last few months has hit our area hospitals, our tri-state hospitals here in our region very, very hard. For the last week, Southern Ohio Medical Center has had to triage our patients and manage our beds hour by hour, minute by minute. Our leaders huddle multiple times a day, morning, afternoon, evening, and even in the middle of the night, to really try to get bed availability, and more importantly, staff to take care of those COVID-19 patients in the beds that are made available. I've been a nurse and a nursing leader for many years, over 30 years as a nurse, and what we are leading our healthcare teams through today is unimaginable. And our goal here today, my goal, is to help our community and those that don't work in a hospital understand what is really going on within our walls. We cannot sustain what we are doing right now. Our equipment and our supply resources are very, very drained. They are limited. And more importantly, we're living in the biggest nursing shortage across this country that I've ever seen in the last 30 years. So our human resources are also very, very limited. And it puts us at extreme risk of taking care of our community. When we talk about available beds, we not only talk about beds for COVID-19 patients, but we also talk about beds for common emergencies for patients in our community that are having heart attacks and strokes and car accidents. Those beds may not always be available today. In normal times, a regional hospital like us reaches out to its partners in the tri-state area and its tertiary centers in Columbus and Cincinnati and Lexington. And today, when we reach out to those centers, there are no beds available. There are very rarely beds that we can transfer our patients that need additional care or more critical care out to those facilities. So we are in a crisis. Terribly long waits in our emergency department. Our ICU has 16 beds today. We made provisions this last week to put 2 beds in 4 of those ICU beds to increase our capacity. We have had 7 COVID-19 deaths in the last 5 days in our ICU. People don't realize what's going on in our walls. Our average age today of a patient with COVID-19 in our ICU is 52 years old. And we had a death yesterday of a mid-30s, a female. Our medical surgical units outside the ICU are also stretched. They're taking care of patients that they're not used to taking care of with high acuities. We opened our 4th COVID unit this week. We had to stretch our limits once again and stretch our needs for supplies and staffing. Our nurses, our respiratory therapists, our support folks, our caregivers that work with us are physically, mentally, and emotionally exhausted. To hear them talk and to see them work, to hear their frustration in their voices overwhelms me every day. And to see the sweat rolling off their face when they're taking their PPE, their layers of PPE off as they come out of these rooms after they're in delivering 20, 30 minutes of care to these people because they are so critical. To see them have to shake off what they see at work is also extremely disturbing because they have to go home while everybody else around them is living a normal life and going to school and football games and parades and craft shows. It's very, very hard being a healthcare worker right now. Our hospital feels like a war zone, and every single person in our facility is a hero. What we desperately want to ask of our community today is to help us out and to be our partner in COVID-19. We need everybody to consider vaccination. There are very, very few tools in our toolbox as healthcare providers to fight COVID-19. And the biggest toolbox we have is prevention. The biggest thing we can do for prevention is vaccination. So we beg you as healthcare workers to consider vaccination. And if you're on the fence, talk to your healthcare provider. Talk to a hospital worker. Talk to somebody who sees what is really happening in our community every day. And maybe that will help convince you that you don't want to be laying in an icy bed here in the next couple weeks talking about removing life support from yourself or a family member. Other tools in our toolbox, masking. If you can't vaccinate, if you're totally against it, please wear a mask when you're in social settings and social distance when you're out in public. All of those things will help us healthcare workers fight this battle. We all want life to get back to normal, and those are the steps we're going to have to take. If you know a healthcare worker, thank them for what they're doing right now. I appreciate all of our teams and what we're doing every day to sustain our healthcare in this community. Thank you.
Amy, thank you very much. That was very, very compelling. We'll now hear from the health departments. Maybe we'll start with Chris Smith from the City of Portsmouth. Chris.
Hey, thank you everybody for being here, and I really just want to make my remarks really to the community of Scioto County and community of Portsmouth. You know, we've been actually envied around the state for having such a great emergency management community. You know, we're Appalachian. We always jump in and help each other. And at this point, the hospital is asking for our help, and we really need to step up and help. If this was a tornado or a fire or a flood, I promise you, almost every citizen would, risk their life to help their neighbor, and they certainly would be making sure and helping the hospital if they needed us. This is the same sort of disaster. It's just a lot slower, plays out over a long period of time, and unfortunately is a lot deadlier. So, we hear a lot of numbers thrown at us, and, I kind of always wonder, do people really, catch what they mean? So to Scioto County, July 1st, we had vaccine available for everybody. We were down to about 20 cases a week, making, vacation plans. We honestly all thought we were going to get life back to normal. So just think about that, 20 cases a week. Now that's over 500 cases a week. 500 cases a week is unsustainable for us. It's unsustainable for the hospital. If we collapse our hospital system, it's not going to be there for the rest of us, regardless of vaccination status. So another kind of number that people don't really think about much, it just doesn't mean much. We hear 2,000 active cases a day. We hear 100 new cases every day. But what does that mean? And remember, we're a very small county, so I wouldn't even want to think of what the numbers are for the big cities and the bigger counties. But those 100 new cases every single day means that our public health force has to try to reach those 100 people, make sure they're either isolated, quarantined, making sure they're getting health care if they need it, try to do tracking and find out who's been exposed and whatnot. But that's 100 new cases every day. So now think of the other 2,000 people. We say those are active cases. If we had the ability, we would be calling those 2,000 people and doing symptom checks with them and making sure that they're okay. We have to triage ourselves and just call the people that are most symptomatic. So we are in crisis. We do desperately need help. You heard from the hospital. Be careful about the statistics again. Just if you see bed counts and you see something like, well, they're at 80%, bed capacity, that doesn't mean they have the staff to do it. There's a lot of factors that go into all this. And when the hospital, our local community hospital, tells us they're in trouble and they tell us they need our help, we need to trust them. We trust them with our lives when we get sick. We need to trust them now. So, we've discussed, the numbers. We've discussed, the number, the overwhelming, conditions in the hospital. I came here to throw out the number of we've only had 5 deaths in September. The other 2 have been added, so we're 7, possibly more. This is how quickly it changes. It can change while we're driving here to a press conference. We can have another 1, 2 deaths. So, the situation is extreme. So it's already been said probably a few times, but I'm going to say, one more time, what we need to do for Scioto County. We're at about 40% fully vaccinated rate, 40%. We need to get to anywhere from 80 to 95%, and we don't quite know what that magic number is going to be. We'll know when our hospitals aren't full. We'll know when we don't have as many cases. We know when we're back down to 20 a week, but we need to get from 20 to 80 to 95% vaccinated. So until we do, this is going to be our reality. We're going to have full hospitals. We're going to be begging you to wear masks, making sure, try to get you to social distance. We're going to be telling you not to gather in large groups, not to go to big events. The answer and the way out of this is simple. We need to move from 40% vaccination rate up to 80 to 95% vaccination rate. That's the way we get back to normal, get back to normal life. Can actually schedule a vacation that we get to keep, go to our events, be with our families. So just kind of closing, the other thing, public health workers, a lot of times, we're not the nurses, we're not the doctors, so we're not as flashy, but, our employees are exhausted. Their phone calls never stop. The work never stops. So I'm not going to tell you not to call us. You can always call us at 740-353-8863. But please look for information on websites, social media, only from your local health department. The Department of Health, the Ohio Department of Health, look at the CDC websites. And you should find most of your answers there. But if you need us, give us a call. We'll certainly answer your questions. That's all I have. Thank you very much, and I hope we can pull together as a community.
Hi, my name's Dr. Michael Martin. I'm the Scioto County Health Commissioner. And if you haven't heard it yet, please get vaccinated. We do have vaccine clinics in our department at the Scioto County Health Department, which is across the street from the county courthouse, Monday through Friday from 8 to 4 p.m. We're also doing mobile clinics. We've been out at 4 different school sites. We've been at church sites, so we're reaching out there. We've given 12,500 vaccines. Our staff is approximately 3 nurses, so they're very busy, and they're very excited about vaccinating you so that you don't end up in the hospital. So I appreciate your time. Thank you.
Great. How about Lawrence County? Who wants to take that? Sure.
Hello, from Lawrence County. We just want to encourage Lawrence County residents to get vaccinated also. Not only as our residents at Scioto County, but we have King's Daughters, Cabell, and St. Mary's. We're in constant communication with the ERs. They are very, very overwhelmed and at capacity also. For Lawrence County, we've had 11 deaths this week. We've also had 140, 115, 120 daily cases. It's very, very difficult. Our vaccination rates right now are not very good. At the same location where we were doing 1,000 a day, we are now seeing 30 to 39. And so it's very, very important that Lawrence County residents get vaccinated. Our clinics are on the website and on our Facebook page, and we are going to try to go to football games. We will do anything. If anybody wants us to come just to do a small clinic, we're able to do that also. So please just get vaccinated. Thank you.
All right. Thank you very much. We're happy to answer any questions.
Are you hearing from hospital staff? Do you hear them talking, saying our lives would be so much better right now if we had these vaccination numbers?
I'll let the hospital folks answer that.
Absolutely. That's what our staff sit around, and well, they really don't sit around much anymore, but they say that all the time. They want the vaccine rates to go up, and if they could get their community on board, they really feel that we would be in a much better shape right now.
Who else?
If cases were to increase, within the schools and the students and also the teachers, would you see a statewide mask mandate being issued for that?
So we've made some progress in regard to voluntarily having schools put on a mask mandate. If you look at Scioto County, for example, we've got some of the schools who are masked, some are not. We would just urge them today, every school to mask. We know it will slow the spread down. There's absolutely no doubt about it. So we're at about 58% of all students in Ohio in public schools are now in a mask situation. That's better than it was when school started, better than it was a week ago, but we certainly have a ways to go. The challenge for me to require that across the state in every school is that the legislature passed a law over my veto where they can undo any health order instantly. They don't have to wait. They come right in. They can take that health order off. So that's the concern I have as I try to balance, what we do next. We don't want to confuse people. We don't want to go backward. We don't want people to think that this crisis is over if the legislature came and got rid of our mandate. So we are where, at this point at least, we are where we are, and what we hope to do is continue to see schools take the action that we saw some schools take last week. We were very mindful, and we felt it was important that when the children's hospitals started telling us about the crisis they were in, we wanted to put them in direct contact with the school superintendents. We did that this week. Next week, we're going to put them in direct contact with their school board members. And so next week, we'll have a date, a time. Any school board member will be able to dial in, will be able to be in contact directly with the children's hospitals, ask them any kind of questions that they want. We're seeing the spread among young people at about twice the rate as we see it among adults. So it is really spreading in our schools. And the schools that are masked are not seeing it spread as much. And the schools that are masking are not seeing as many kids in quarantine. So if we want to have our kids in school, which I think everyone wants, liberals, conservatives, Republicans, Democrats, I think everybody wants our kids in school. The way to have the kids in school is more kids to be vaccinated, those 12 and above who can be vaccinated, and kids not vaccinated or can't be vaccinated, wear a mask. And we're just, again, pleading with the schools to have these mask mandates on. They do not have to last forever. We may be out of this great spike in a matter of weeks. We don't know. But at least for now, this is one of our tickets out. Nothing more important than vaccine. If you can't be vaccinated, this is the next best thing. Anybody else? Who else? We've done 3 of these today. Three different media availabilities, and I will just tell you that the most compelling people who have talked have been the people who work in the hospitals. It's one thing for me to try to describe it, but I've listened today in 3 different communities, Southern Ohio, to people who work in the hospitals who are dealing with it every single day. And I cannot imagine how bad it is. And it must be particularly tough when they know that virtually every one of the deaths that they're seeing from COVID could have been prevented. Of all the people in our hospitals for COVID since January, 98% of them were not vaccinated. So, that's just, to me, a very telling statistic. Any death is bad, whatever age. It's difficult for a family. No one wants to see anyone die. But I think these deaths among 30-year-olds and 40-year-olds, 50-year-olds that have a long life ahead of them, grandparents, parents who are dying. I think it's much worse when we think of the fact that those deaths could have been prevented. You know, most of these deaths could have been prevented if that individual had been vaccinated. So when these hospital personnel are seeing these deaths and dealing with people every single day, it must be particularly hard to know those lives could have been saved if that person had been vaccinated. So, all right. Thanks, everybody. Thank you.